bright teeth, a beautiful smile, a healthy mouth.
That was a great checkup. We'll see you again in 6 months. Hi, I'm Dr. Robert Mongrain. Most of your patients would tell you this is what they want. Our job as dental professionals is to apply the latest science and technology to help our patients achieve these dental health goals. Today, at the dawn of the 21st century, the prospect of healthy teeth for a lifetime is more than just wishful thinking. With proper care and treatment, most anyone can grow old with their natural teeth. The challenge before you is to recognize that in order to achieve the goal of teeth for a lifetime will require innovation and an objective look at the way we've treated tooth decay for over 100 years.
100 years ago, at the turn of the 19th century, G.V. Black was changing the face of dentistry with new and innovative ways to fight tooth decay and loss. The science was young, and Black was a visionary. He studied the science as it was in his day and then set about to improve that science. He became a chemist and created his own unique formulations for restorative materials. He designed oversized reproductions of teeth and dental instruments to teach students how to correctly prepare teeth for restorations. G.V. Black did more to establish the science of dental medicine than any single person until that time or since. In 1896, just before the 20th century, he correctly spoke about the future of dentistry when he said, "The day is surely coming when we will be engaged in practicing preventive rather than reparative dentistry. That day has arrived."
Thank you, Carla. 100 years later, at the beginning of the 21st century, advances in dental medicine make it possible to change the face of the dental profession by changing the lives of our patients. Not all that long ago, the answer to tooth decay and periodontal disease was simple: extraction. G.V. Black systematized operative dentistry, which extended the natural life of teeth, making it possible for patients to keep them longer. But as the life expectancy for men and women has continued to rise, more aggressively conservative techniques will have to be employed to ensure that patients' teeth will last a lifetime. To that end, modern dentistry faces a challenging problem. Although current dental technique has helped us to dramatically slow the rate and incidence of tooth decay, it has not altogether eliminated it. Current studies have shown that tooth decay has become more difficult than ever to diagnose by conventional means. And if diagnosis is difficult, conservative treatment will be even more difficult. Among the trends seen today is the development of decay under the occlusal pits and fissures. Decay which in many cases cannot be detected during the typical dental examination using traditional diagnostic tools. By the time the caries becomes clinically evident, the damage to the tooth is extensive and irreversible. Consider your own practice. How many times have you opened up a stained pit you had been watching only to find significant decay underneath? A major study in the early 80s, sponsored by the National Institute of Dental Research, showed that 90% of new decay in fluoridated areas and 80% in non-fluoridated areas is on the occlusal surface. Other studies show that we are only able to detect a maximum of 40 to 50% of the decay on the occlusal surface with our current techniques. Clinical Research Associates concluded in its report of December 1999 that almost every stained pit and fissure in people under the age of 30 who were non-smokers had caries under it. What does this mean to you in your practice? It means that the days of the watch are over. When these areas of decay become evident, it may be too late for you to help your patients avoid lifetime damage to their teeth. In order to control this new epidemic, we as dental professionals are going to have to deal with the problem in new ways. Whatever we do or don't do today will affect our patients the rest of their lives. We must be thinking of 60-year treatment planning. Our patients expect us to help them care for their teeth. It's why they continue to trust us year after year. If there are new methods to help them achieve their goal of teeth for a lifetime, they expect us, as their dentists, to make those methods available to them. And if we can do this, and be cost-effective at the same time, why wouldn't we want to consider anything at our disposal?
Air abrasion is one of those methods. Air abrasion offers us a way to help control this epidemic of almost undetectable tooth decay in a way that is much less harmful to the tooth and much more pleasant for the patient. Consider our current traditional methods of treatment. Even though Dr. Black was a revolutionary in his approach to tooth repair, traditional dental treatment still requires the destruction of the tooth before a repair can be done. This requires an anesthetic administered by a needle placed in areas of the mouth that are extremely sensitive. For obvious reasons, your patients do not like this. It requires the use of a high-speed drill, which by its very nature is destructive to the tooth and unpleasant to patients. And the end result of your effort, although it may be long-lasting, may only delay the loss of the tooth due to the weakening of its structure by the very operation you perform to save it. Air abrasion can effectively minimize this problem. Air abrasion can often be done with little or no anesthetic in adults and children. And more importantly, it's a vastly superior treatment which will produce much better results without destroying the structural integrity of the tooth.
What if your patients knew that their visit to your office would not include an anesthetic administered by a needle? What if there were no drill? How do you think they would respond? Do you think it might be easier for them to keep appointments? Do you think there might be fewer dentist jokes? I believe that every general practice in America can benefit from including air abrasion and high-speed curing with the ArcLight 2 as a means of combating dental decay. And in addition to being used in the treatment of occlusal decay, Class 2, 3, 4, and 5 restorations can be completed, as well as porcelain repairs.
Proof of the effectiveness of the air abrasion technique can be seen in the ease of operation by the doctor and the stress-free attitude of the patient. This is an air abrasion procedure being performed without anesthesia using the Air Dent 2. We are restoring the lower right first molar. You can see that this patient has undergone preventive dentistry in the past due to the presence of a dental sealant. Over time, part of the sealant has been lost, partially exposing the fissures. Not only are these grooves heavily stained, but there is a significant amount of undetectable decay. As the air abrasion tip is manipulated, the surface stain is removed to expose more of the underlying caries. Using caries indicator, the doctor continues to remove the decay. The soft, leathery decay is removed using a number 2 round burr in a slow-speed handpiece. It's surprising how much decay can be present under an innocuous stain. The operator will continue to check for and remove decay with the caries detector as a final check. Then the tooth will be etched. Bonded. And restored with a flowable composite. In a matter of minutes without any anesthesia, the procedure is complete.
Well, that looks good, Bill. The benefits of air abrasion to your practice can be tremendous. A less invasive procedure without anesthetic means greater productivity, and an increase in treatment planning as you learn to recognize and control the epidemic of occlusal decay in your patients' mouths. Most practices should and do restore between 30 to 50 of these lesions every month, and your patients will immediately see the value to them and to their pocketbooks when they do not have to undergo anesthesia to receive treatment in multiple quadrants in a single appointment.
Your air abrasion instrument for the 21st century is the Air Dent 2, designed and manufactured by Air Techniques, a leader in oilless compressor technology. In combination with high-speed curing using Air Technology's ArcLight 2, these two instruments can help bring your practice into the 21st century. The Air Dent 2 has a proprietary design to ensure an even powder flow and reliable, trouble-free operation. Thoughtful design minimizes powder overspray and reduces sensitivity to a minimum. Since 1962, Air Techniques has been bringing well-designed, reliable products to dentistry. Air Techniques stands behind the Air Dent 2 with unparalleled service and support. Training in the techniques of air abrasion is also available.
Just as it was at the turn of the 19th century, today we again are experiencing a revolution in dentistry. 100 years ago, the dental revolution was orchestrated by one man, a man who was not satisfied to do things the way they had always been done. Through his research and creative thinking, the science of dentistry was changed forever. To take the next step in the evolution of the dental profession, we, as the practitioners of our day, must approach our science in much the same way G.V. Black did. We must look for new ways to improve our patients' lives through prevention, detection, and early treatment. New technological ideas are part of that revolution. Dr. Black believed in the concept of teeth for a lifetime. If he were alive and practicing dentistry today, chances are good he would be using air abrasion.
We hope we have helped to create an interest in this new technology. To learn more about air abrasion, the Air Dent 2, ArcLight 2, and what these technologies can mean to your patients, call your full-service dental dealer today or Air Techniques at 1-800-AIR-TECH.